Kendall County, Illinois, a great place to live and a great place to work. So you want to get to know us here in Kendall County. Let me tell you a couple things about our community. We have about 125,000 total population. The white population is about 87%, being the biggest ethnic group. Our female population is about 50.5%, and we are fairly young. Most families with 1 to 2 children. Our 65 and over population is only 9.3. But as we all know, with the baby boomers aging, this population is going to start growing, especially in a community like we're in with a lot of farming families. A lot of them are starting to get older. A lot of the farms are starting to be sold off, and a lot more properties are being bought around us to put up new assisted living facilities and community housing for seniors. The leading cause of death right now in Kendall County is lung cancer, and it's been that way for the past 5 years. 39.3 deaths per 100,000 members of the population and an incidence rate of 54.6. Frequently, it is more often men than women, but that number is changing with the aging population and the higher incidence of female smokers aging. What are the risk factors? We all know that smoking is a risk factor, but here's the thing. There's so many other things that you're exposed to on a daily basis, especially around farming communities, all of the equipment plants that are around the mobile plant and that kind of thing. Exposure to diesel exhaust, a family history of lung cancer. Maybe you've had it yourself in the past. Maybe you've been around radon or asbestos or several other inhaled chemicals through your job or farming equipment. What can you look for to catch it early? We all know that cancer is better to catch as early as possible, and lung cancer is no different. Frequently, it's caught at the very tail end with late stages because everyone kind of looks past a couple of these symptoms. If you have a cough that doesn't go away or gets worse, coughing up blood or rust-colored sputum, hoarseness, any weight loss or loss of appetite, fatigue, shortness of breath. Frequently, it shows up in recurrent infections, bronchitis, pneumonia, those kind of infections that keep coming back, or you take antibiotics for them and they don't get any better. New onset wheezing. The late stages are usually when lung cancer has transferred to another organ. Bone pain, nervous system changes, weakness or numbness, seizures, balance problems, any yellowing, lumps near the neck and skin, collarbone region. So what can we do to catch it earlier? If you know you've been exposed to these chemicals, there's some guidelines from the American Cancer Society for low-dose CAT scans. If you're 55 to 74 in fairly good health, meaning no major disabilities, no severe chronic illnesses, and basically per discretion by your physician, have at least a 30-pack year smoking history, and either is still smoking or have quit within the last 15 years. What they can do is a chest x-ray, the low-dose CT, there's also sputum testing, so they'll have you cough and bring that in, or they can go down your throat to check out everything that's going on while you're asleep. There are 3 basic groups of lung cancer. The first is non-small cell cancer. 80 to 85% of lung cancers fall into this category. The other 2 types are small cell, often called oat cell, and lung carcinoid tumors. Well, now that we have got the basics down for lung cancer, what can we do to do a little bit of prevention? Most doctors say that eating well, having good exercise, good habits is the way to go, and when you get diagnosed with lung cancer, that's no different. The goal is to give you as much lung capacity, much breathing room as possible. So what's an activity that we can do that would help us exercise, keep our muscles lean, and help with pain, some meditation? Wait a minute, let's think. Yoga! Yoga would be perfect, but let me tell you why. Yoga is the art of deep breathing. It is the practice of breath. And for lung cancer patients coming to our weekly meetings after their treatments, they can relax. There's no expectations. Whenever you go to yoga, whatever you do on your mat is your practice. Stretching sore muscles, connecting with the others in your group. It's a very calming experience for everyone involved. Low lights, easy to breathe, exercises that will help open up the chest, stretch those muscles, give you that room to breathe, give you that full expansion that you need to make sure that you're going to be able to do the best you can with your treatments or to prevent any kind of illness. The great thing about it is that it can be modified for anyone. If you have a previous injury, that's not a big deal. Every position and pose can be modified safely. And the goal is to do what is best for you and your body, and that changes on a daily basis. We all know that yoga is great for everybody. But the new weekly program that we're going to have for lung cancer patients here in Kendall County is going to be amazing. It's going to be a supportive group that anyone is free to come to. Lung cancer patients, patients who would like to help or just want to go to yoga, or their family members are lung cancer patients. It's going to be the greatest collection of people all wanting to get better and well and do the best that they can for each other. I hope you'll join us.